Welcome everyone, and thank you for joining our webinar. Today we're excited to introduce you to the Agriculture, Food and Nutrition Evidence Center. I am Stella Sproblis, an engagement strategist with the Evidence Center, and will serve as the facilitator. During our webinar, we will provide an overview of the Evidence Center and welcome your questions during the presentations, and will respond to each of you following the webinar. If you have any questions during the webinar, please email us at evidencecenter@ag.tmu.edu or scan the QR code on this slide. After the webinar, we will post the recording and share the slides as well. First, I want to introduce the speakers. We will hear from Dr. Kellie Casavale, the Director of the Evidence Center. Dr. Casavale leads the vision and strategy for multidisciplinary growth and multi-sector collaboration, serving Texas, the United States, and other entities worldwide. She began her leadership at the Evidence Center in May of 2025, following 20 years of federal service, leading cross-organizational scientific collaborations and systematic review programs to inform federal research and policy at the U.S. Department of Agriculture and the U.S. Department of Health and Human Services. During her time at the U.S. Department of Agriculture, the systematic review methodologies were founded and are relied on today for the dietary guidelines for Americans. In her previous roles, Dr. Casavale has led the process for developing the dietary guidelines for Americans, and she was instrumental in setting standards for prioritizing systematic review questions to inform dietary recommendations. Dr. Casavale founded the Federal Data Consortium on Pregnancy and Birth to 24 months to establish scientific collaborations to curate maternal and child health data. She also founded the Human Milk Composition Initiative in the U.S. and Canada. More recently, through her role as Senior Science Advisor for Nutrition at the U.S. Food and Drug Administration, Dr. Casavale supported multiple maternal and child health programs focused on promoting a healthy diet while limiting exposure to contaminants. She has also supported the U.S. delegation of Codex Alimentarius on international standards for infant formula. And we will hear from the Associate Director of the Evidence Center, Dr. Maureen Spill. Dr. Spill came to the Evidence Center in 2022 as the founding lead of the Evidence Center's Nutrition and Health Program and became the Associate Director in 2024. Dr. Spill has more than 20 years of food and nutrition research experience. Prior to serving at the Evidence Center, she was a lead analyst for the U.S. Department of Agriculture's Center for Nutrition Policy and Promotion's Nutrition Evidence Systematic Review team. Dr. Spill led systematic reviews used to inform the dietary guidelines for Americans, including the 2015 and 2020 editions, as well as the Pregnancy and Birth to 24 Months project. Dr. Spill has experience in industry, academia, and public policy. She was a senior researcher at Pew Charitable Trust, a fellow in the Laboratory of Human Ingestive Behavior at Penn State University, and a senior sensory researcher for Campbell Soup Company. She is passionate about building strong teams and advancing methods to produce high-quality systematic reviews that inform policy to improve health. And now I'll hand it over to Dr. Kellie Casavale.
All right. Thank you, Stella. So I'm Kellie Casavale. I'm the Director of the Agriculture, Food and Nutrition Evidence Center. And thank you guys again for joining us today. So today, my aim is to introduce you to the Agriculture, Food and Nutrition Evidence Center and where we sit in the state infrastructure of Texas. I'll describe why we were created and how implementing our mandate is, by design, an asset to support decision makers in policy programs and regulations. Then I'll pass the floor over to my Associate Director, Dr. Maureen Spill, and she will walk you through a number of recent Evidence Center projects, and we'll close with sharing more information about how you can connect with us, including how you can commission us to conduct work. So first, let me tell you about where we sit in Texas. So in 1876, Texas established its first college, the land-grant Agricultural and Mechanical College. That's where the A&M comes from. And so what we know now is Texas A&M University. And it is actually one entity within a much larger, rather massive system called the Texas A&M system. And that was created under Texas legislature in 1948 to manage the evolution of state education, research, and service systems. So in fact, the Texas A&M system actually includes these 12 universities, and it also includes 8 state agencies, of which 4 of these state agencies are agricultural agencies: AgriLife Research, the Veterinary Medical Diagnostic Lab, the Forest Service, and Extension. And so you see AgriLife here And AgriLife Research is what used to be the Texas Agricultural Experiment Station. The Agriculture, Food, and Nutrition Evidence Center opened in 2022 and is part of this agricultural agency. So big confusion is often that we're part of Texas A&M University. We love the universities, but as you can see, we're actually not part of the university, but we do collaborate on research with the university faculty, many of which are likely joining us today. So as far as our funding, as a state ag agency, we receive some base dollars from the state of Texas. Primarily, though, our work is funded through research projects commissioned by state, federal, and international government agencies, other scientific institutes or organizations, and generally many other public health entities can commission us to do work. So these entities would commission the Evidence Center when they need to evaluate the state of the science in a particular area and have the existing science then synthesized or brought together, so to speak, in a systematic and rigorous way so that they can make the decisions they need to make about their respective policy programs and regulations. So when commissioning a research project from us, it simply starts with a conversation on a concept while making sure that you're following our respective contract rules. There are likely many different mechanisms with which we can commission work. Our primary mechanism, though, is typically a contract agreement. We are in the GSA schedule, and we will share that information on a closing slide. If an entity releases a request for a contract for proposals, a request for proposals, we can submit to compete for those projects as well. However, we were established because there is an area of scientific evidence that agencies need to evaluate to inform their decisions in food and agriculture. And previously, no independent entity specialized in many of these areas. So now that this evidence center exists, there is precedent for what is called sole source contracts. So let's talk a little bit about our mandate. The Evidence Center was established to fill a crucial gap that was vocalized in the agricultural leadership in both Texas and in the federal government, which was the need for an independent scientific entity that could complement the existing methods in the evidence synthesis in food and nutrition by bringing food and nutrition systematic review into the larger landscape of agriculture and food systems. And so this is one way in which we are unique. And I will say more about that scope in my later slides. The vision in our mandate for the Evidence Center is pretty big. So it says that we are to become a global leader and an independent, unbiased, authoritative body for the review and synthesis of scientific evidence. Evidence Center collaborations are expected to drive advancements in evidence synthesis methods that enhance precision and speed. I'll pause here because I find this aspect of our mandate just so exciting. So what could we accomplish if we could know what we do and don't know faster and with greater accuracy? This is really an exciting space, and we look forward to collaborating with many of you who may be watching this webinar as we move forward with this vision. So in addition, the center will help to cultivate standards. So for example, how to determine that systematic review findings on a topic are comparable in standards of quality across different disciplines. How does each evaluate bias? We also look for opportunities to extend the practice of those common standards more broadly across the evidence synthesis community. So this slide shows the overview of 4 principles within the frame that is our bread and butter at the Evidence Center, which is systematic review methodology. The Agriculture, Food, and Nutrition Evidence Center was also established to conduct, and I quote, rigorous and agnostic synthesis of the scientific evidence base to support science-informed practice and policies and for engendering public trust with clear communications regarding what is known, what is unknown, and what is uncertain. And I'll come back to this as well. But supporting this vision are our 4 core principles: independence, transparency, rigor, and commitment. So first is independence. The Evidence Center was established to operate independent from outside influence. We are organized within AgriLife Research within the largest Texas system. However, even within AgriLife, we have a well-respected firewall that allows the Evidence Center to operate independent from influence of our parent organizations. Our scientists also conduct research where external influence is minimized. Dr. Spill will present this process flowchart that demonstrates the approach to ensuring that the analyses remain objective and transparent. External funders are involved in setting the scope of the study, but are not involved in the research process itself. And external experts do serve as advisors in distinct touch points, which are clearly defined and implemented as such. So we also see that what our role is and is not very clearly. The Evidence Center synthesizes and communicates what the evidence shows without offering policy, program, or regulatory recommendation. That role rests solely with you, the decision makers of programs, policies, and regulations, so that you can rely on unbiased and complete information. So our next principle is rigor. I can't emphasize enough how central rigor is to our thought processes in the Evidence Center. In our work, we demand uncompromised quality from ourselves in the research we produce. And we are also mandated to advance methods. And as those methods advance, the Evidence Center is constantly reevaluating and looking for higher quality ways to ensure that rigor. So next is transparency. In every step of our process, we ask ourselves if the process and methods we are using are or will be made as open and as available as possible. Our research methods are developed a priori, that is, they're developed before the work begins, and with the goal that our research could be reproduced. And what I mean by that is another adequately trained and experienced research group should be able to repeat our method based on our documentation. We also make our funding sources, our research methods, our findings, and our scientific communication products publicly available. And we strive to publish all of our research in peer-reviewed journals that provide access to the public free of charge. So last but not least is our core principle of commitment. The Evidence Center staff have a lot of heart, and they are very committed public servants that improve public health through science. So Dr. Spill and I are both very devoted and trusted leaders with an unwavering commitment to see the Evidence Center meet those high expectations of our mandate. But the commitment of the Evidence Center is not just to develop new methods and conduct rigorous science. We also invest in tailored trainings in evidence synthesis based on needs assessments and actively extend these opportunities to get better at methods to you as the broader scientific community. If there is a need that you have for training in evidence synthesis methodology, we want to know what it is, and we want to help your team achieve those skills. So now I'm going to pivot a little and get back to the uniqueness of our scope. A key aspect that makes the Agriculture, Food, and Nutrition Evidence Center unique is the scope and approach within our mandate. As far as scope, we evaluate the relationships between food and nutrition and health outcomes. But many evidence centers do this well also. What makes us uniquely capable is that our scope builds on that research and goes broader to include synthesizing the evidence on agriculture and food systems in addition to food and nutrition. The health outcomes in the scope of our work are also broader. Health outcomes we evaluate go beyond human health to also include the health of our natural resources and our environment and economic health, from the economic impacts of agriculture in rural communities to the health of our economy in the United States. So our scope is pretty broad, which naturally fits our purpose to drive new approaches for multidisciplinary evidence synthesis. Now, what do I mean by multidisciplinary evidence synthesis? It's a mouthful, but you will hear me say it a lot. Well, you can see it here in this graphic. Many different scientific disciplines are needed to study the relationships pictured in this slide. And the Evidence Center mission includes growing to elucidate the state of the science in an integrated view. So to move towards the larger vision for the Evidence Center, we will build on work in the nutrition and chemical food space that Dr. Spill will share today, with work in the microbial safety food topics as well. And we are complementing those disciplines with others like you see here. And this becomes our first multidisciplinary evidence synthesis framework. Now, I know that's a mouthful, right? But this framework, what it will do is allow us to evaluate the state of the science from many different perspectives in many different domains, providing a more holistic, comprehensive view of the available science to inform decision makers. The Evidence Center is developing logic models to explore the relationships between food exposures and health outcomes that include multiple domains of influence and all of those touch points, with the goal to make it very clear that on any given topic, what is known, what is unknown, and what is uncertain, so that decision makers are well informed on all the pivotal levers at their disposal to create positive change. Now, let me talk about this part of our mandate a little bit more. On this slide is a quote from our mandate: endearing public trust with clear communications regarding what is known, what is unknown, and what is uncertain. And I just think that this is so eloquent. So not only will the Evidence Center characterize the available evidence, we will characterize what is not known. Systematic reviews identify evidence gap. What decision makers need to know is what the potential importance may be of those evidence gaps. What is the importance of the things we don't yet know? And the Evidence Center will characterize and, when possible, quantify the relevance of making the unknown seen, including the quantitative cost benefits. So back to our bread and butter. Our approach uses rigorous methods to synthesize existing evidence that answers scientific questions to inform decision makers of policies, programs, and regulations. Certain scientific disciplines don't have methods for systematically reviewing the body of science yet. And so we are actively developing studies to develop and pilot those new methods in some of those scientific areas, but it will take time to move through them all. But we don't do this alone. The Evidence Center is positioned to be a central communication hub for evidence synthesis, to collaborate with scientists across disciplines and across evidence synthesis centers and experts. Our mandate to create methods that allow us to synthesize evidence faster and with greater precision will be a collaborative journey. And we hope those of you out here who see that you can have a role in that journey, please do connect with us, because we want to work with you. We also have some exciting platforms and products that we're developing that will foster that engagement. So we also specialize in scientific communication. And it's not just enough to evaluate the science. We also want to make this science really engaging. It should be interesting, easy to understand, and easy to apply to your work. So we will have a number of communication products, including research briefs, research infographics, and engaging scientific graphics like interactive videos that really can bring you in to explore the science yourself and what is meaningful to you. The Evidence Exchange will be a platform for engaging and sharing information, and also planning events that allow us to bring knowledge together and share what we are experiencing, what we think is needed to raise up and advance the discipline of evidence synthesis. So it is now my pleasure to introduce my colleague and my Associate Director of the Agriculture and Nutrition Evidence Center, Maureen Spill. Dr. Spill will give you a sneak peek at how we are putting our mandate to work for policymakers and examples of our other pillars in training, in collaboration, and also in those scientific communications. So over to you, Maureen.
Thanks, Kelly. Okay, we realize that not everyone watching this may know what we mean when we talk about evidence synthesis. That's okay, I'm going to cover it for you. I'll start with some background on what evidence synthesis is, why it's important, and how we do it. I'll also show examples from work of the Evidence Center to hopefully bring this to life. Evidence synthesis refers to reviews that employ formal, systematic methods to minimize bias in the process of identifying and synthesizing evidence. This figure is from a recent publication that highlights the most common types of evidence synthesis products. Note on the left that narrative reviews are not considered part of the family. This is because narrative reviews lack the rigor to reduce bias. I'm going to go through each of these pretty quickly. Systematic reviews synthesize quantitative evidence. I will spend more time describing systematic reviews in a minute. There are also methods for synthesizing qualitative evidence as well. And mixed method reviews synthesize both quantitative and qualitative evidence. Overview of reviews, which you may have heard of before as umbrella reviews, are just what they sound. They're systematic reviews of existing reviews. They're very useful when you have a topic with a lot of evidence where timely, relevant, systematic reviews already exist. And finally, big picture reviews are slightly different because they don't actually synthesize the evidence. They have a structured process to identify and describe evidence to show where evidence exists and where it doesn't. These include things like scoping reviews, evidence maps, and gap maps. So now let's take a closer look at systematic reviews. When we talk about evidence synthesis, usually we're referring to systematic reviews. So what are they? Systematic reviews are a type of research that address important questions by identifying, evaluating, and synthesizing all available evidence on a topic. Systematic reviews as we know them came about in the 1970s and 80s in the fields of medicine, psychology, and education, but really took off in the 1990s with the establishment of evidence synthesis organizations like the Cochrane Collaboration. Now, systematic reviews and meta-analysis are widely used and appreciated across disciplines and are considered to be the gold standard approach for using evidence to inform policy and practice decisions. This is because high-quality systematic reviews are comprehensive, transparent, and reproducible, and because they critically appraise the evidence and communicate a level of certainty. Since their inception, systematic review methods have evolved. They started with a focus on randomized controlled trials, but now there are methods and tools to incorporate a variety of study designs. The field continues to evolve, which is one of the reasons why I love working in this space. And as Dr. Casavale mentioned, the Evidence Center's mandate and mission is to contribute to the evolution of evidence synthesis methods. Now I'll walk you through a very high-level overview of the systematic review process. First, you identify the topic or question, and then you have to refine it. So, for example, you may want to ask, do heavy metals in baby food affect child development? That's a great question. I'm sure a lot of people would love that answer. But before you can begin a systematic review, you need to clarify aspects of your question so that you're focused. You don't want to go into a systematic review with a question that's too broad. So you go through a refinement phase. And during this phase, you define your population, intervention or exposure, comparators, and outcome. In this example, you may ask, what heavy metals should be included? All of them? Are there particular ones of concern? And what kind of baby food are we including? Manufactured store-bought baby food, homemade baby food? Is it just for infants in the US, or is it focused on infants in underdeveloped countries, or maybe just developed countries? And thinking about the outcome, child development is pretty broad. Are you interested in a particular type of development, cognitive, motor, physical development? Are there validated tests or measures for these outcomes that you'll want to focus on? All of these details need to be fleshed out up front so you have a focused review question. The protocol includes these details as well as a roadmap for how you'll conduct the review. And this serves as your blueprint for the rest of the review process. Once finalized, protocol should be registered in a public registry like Prospero before you move forward with the review. Once you've registered your protocol, you can begin your review, starting with identifying the evidence. This happens by systematically searching all relevant databases and other sources of evidence. Then the results of the search are screened using predetermined eligibility criteria that were outlined in your protocol. I want to stress that a comprehensive search and screening process that's designed to capture all relevant evidence is a critical step of the systematic review process and differentiates it from the typical narrative reviews or literature reviews, where evidence may be limited by the researcher's knowledge or objective. Once you've identified your included articles, trained analysts extract data in a systematic way and assess the risk of bias for each study. The extracted data and risk of bias assessments are then used in the synthesis, which results in the answer to your systematic review question. Finally, the certainty of evidence is evaluated. This indicates how likely the findings will change or stay the same if new evidence emerges. High certainty means it's unlikely to change, whereas very low or low certainty means that the results are more likely to change if new evidence emerges. A de novo systematic review is basically your standard systematic review that's initiated and completed. Systematic reviews can be updated. Once a review is complete, you can update the search to identify new evidence and then follow the remaining steps of the process synthesizing evidence from the initial review with the newly identified evidence. A more recent development is the living systematic review, where a review is initiated and, again, completed, but then the evidence is continuously monitored and incorporated into the review to allow for timely updates. This requires a detailed plan for the frequency and approach for integrating new evidence. It entails a long-term resource plan, both in terms of staffing and budget. But living reviews are particularly valuable for important questions with emerging research. I also want to mention systematic reviews with meta-analysis. You may hear the term systematic reviews and meta-analysis a lot. Some may even think that they're interchangeable, but they're not. Meta-analysis is a quantitative method for synthesizing the evidence. It's part of the synthesis step, step 6. You can have a systematic review that does not include a meta-analysis. There are other forms of synthesis. At the same time, you can meta-analyze data that's not from a systematic review. So systematic reviews may include meta-analysis, but just remember that a meta-analysis and systematic review on their own don't necessarily mean the same thing. Now I'm going to transition from talking about evidence synthesis more generally to evidence synthesis at the Evidence Center. Dr. Casavale briefly showed you this image earlier, and it is busy. Don't worry, I will walk you through it. This is the flow of our process from initiation of a research project through project completion. It starts at the top left with a client that has a research question. The director reviews the question and decides if it's something the Evidence Center should pursue at that time. And there are several reasons why we may not want to pursue a proposal. For example, it might not fit within our scope, or we may not have availability at that time. But if it seems like it's worth pursuing, the director may request that our research team conducts an evidence scan. This evidence scan is intended to give us a quick read on the volume and general characteristics of the evidence base. We use this information to draft a proposal, which would include our recommended type of review or reviews, along with the time and budget to carry them out. The director will then share the proposal with the client, where there may be some back and forth to refine the scope and other parameters. Once a contract is in place, so now we're starting up here. Once a contract is in place, the project will be assigned to a research team, and then we'll convene a group of subject matter experts we refer to as a technical expert panel, or TEP. The research team, along with the TEP, will develop the protocol. Remember, the protocol includes clearly defining critical aspects of the question, like the population of interest, the intervention, and so on, as well as the research plan. Once drafted, the director will review and may share it with the client to ensure that the protocol addresses the client's question. The final protocol is registered, and then the review begins. So now we're down here with our research team. The research team conducts the review and writes the report. If we have specific questions, we will reach out to the TEP, but generally the experts are not involved in conducting the review. Specifically, they inform the protocol, but they do not select the studies, extract the data, assess risk of bias, synthesize or grade the evidence. That's all the responsibility of the research team. This delineation is intentional to minimize bias in the review. Once the review is complete, we engage our communications team to produce additional materials as necessary. This could include data visualizations, infographics, policy briefs, etc. And I have to mention that we have a very highly skilled communications team, as you may have noticed through our lovely graphics. They're fantastic, and we can utilize them to help amplify the work. Finally, the report and other materials are provided to the client. We also aim to publish all of our research in open source peer-reviewed journals. And just one last thing before I move on from this slide, I want to stress the importance of the division between the client and the research team. Again, this is a critical step to reduce bias. Now I'm going to go through examples of our capabilities, starting with some of our project work. I'm not going to have time to get into a lot of details or results, but the slides will have a QR code that would take you to our project page if you'd like more information. The first project I'll discuss was our first commissioned project, actually. Remember, we're only 3 years old. The role of seafood consumption in child growth and development, which was commissioned by the National Academies of Sciences, Engineering, and Medicine. We were commissioned to address 2 questions. What are the potential nutritional benefits associated with seafood consumption? And what are the potential risks from seafood consumption? For both of these topics, the exposure period was during pregnancy and or lactation or during childhood, and the outcomes were measured in children. To address this question on nutritional benefits, we updated 2 systematic reviews that were conducted for the 2020 Dietary Guidelines for Americans. Now, the question on potential contaminants was really broad. The expert committee identified a long list of contaminants and a long list of outcomes of interest. It was too broad for a systematic review, so we started with a scoping review. This is an image of an evidence map that shows where the literature did and did not exist. Now, I don't expect you to read this, but just to orient you to it, exposures or the contaminants are along the rows, and the outcomes are in the columns. The color of the cell where an exposure and outcome meet indicate the volume of evidence. White cells indicate that no studies met the inclusion criteria, and green cells show the presence of evidence. As the green color gets darker, the volume increases. If you look down here in some of these rows, you can see that there is no evidence, that they're all white. Now, if you look up here where there are a number of darker green cells, these represent areas that have a lot more evidence. Not surprisingly, that's mercury and methylmercury. So this scoping review helped identify topics for further work. We completed 2 de novo systematic reviews, one on exposure to lead from seafood during pregnancy and lactation on neurodevelopmental outcomes, and a systematic review with meta-analysis on maternal PCB exposure and child growth outcomes. Finally, given the amount of evidence on mercury and methylmercury, and for the sake of time, we agreed that rather than conducting a de novo review or a systematic review update, we would instead conduct an overview of systematic reviews. Our overview included 29 existing systematic reviews on mercury exposure and child outcomes. This project resulted in 6 peer-reviewed publications, but we were really excited to see the work stimulate discussion via an editorial in Advances in Nutrition and a letter to the editor in Environmental Research. And we were invited to contribute a commentary where we were able to discuss the importance of integrating multidisciplinary evidence, particularly as it relates to seafood and child health outcomes. Next, we're going to pivot to 2 projects commissioned by the U.S. Food and Drug Administration on potential contaminants in foods. The first project was a series of reviews on potential contaminants in human milk and infant formula. We were given a list of questions from the FDA, which we organized into this framework that shows the full scope of work. There are many sources of contaminants that impact infant exposures. The primary exposures and outcomes for our systematic review questions are in blue, while the other important exposures that were not directly assessed in these reviews are in gray. Essentially, we ended up conducting 6 systematic reviews that covered a variety of topics, starting with number 1, examining the relationship between maternal exposure and contaminant concentrations in human milk. Question 2 covered contaminant concentrations in human milk and infant formula. There were several questions on bioavailability, including bioavailability of the contaminants themselves, how contaminants affect the bioavailability of other nutrients in the milk and formula, and factors that influence bioavailability. And then question 6 was on contaminant concentrations in infant biospecimens. From these 6 systematic reviews, we prepared 3 manuscripts. One was recently published in AJCN and was accompanied by an editorial, and there are 2 currently under review. I'll next talk about another project commissioned by FDA. This was titled A Scoping Review and Research Gap Analysis of Contaminants in Agricultural Production of Food for Human Consumption. The scope was quite broad, even for a scoping review. FDA agreed to limit it to 4 heavy metal contaminants: arsenic, cadmium, lead, and mercury, but they didn't want to limit foods included. So any food sold for interstate commerce was included. They did exclude food from recreational activities like hunting, fishing, or gardening. The production processes were limited to those prior to manufacturing, so there was a focus on agricultural production. And we had an amazing TEP that worked through a process flow for each food domain that delineated the processes that would be included as agricultural production processes and those that fell later in the supply chain. As far as I know, this may be the largest scoping review ever conducted. I might need to verify that, but we screened over 76,000 records, and keep in mind that each record was screened independently by 2 reviewers. And we had over 10,000 articles included. So again, this was a massive amount of work. And what do you do with that much data? Yes, we came up with some nice tables showing intersections of the foods, processes, and contaminants, but we wanted to go one step further and add value and make this data more useful for FDA, who commissioned it, and other food regulatory agencies. So we created an interactive evidence map. I've included some screenshots so you can see how useful this resource will be. Foods are organized in rows. Agricultural production process categories are organized in the columns. The bubble colors indicate the contaminant. The bubble size indicates the amount of evidence. When you hover over a cell, it'll show you the number of articles identified for that particular food process pair by contaminant type. You can expand the rows and columns to get more detail. In this screenshot, I've expanded the food rows and the agricultural production process category columns for crops. Again, if you hover over, you can see the number of articles. And if you click on a cell, you'll get a list of all the articles from that food process pair. This list comes up in alphabetical order, but you can sort it by author or contaminant type. And for each article, you get the title, you get the citation, and in most cases, there's also a link to the article's full text. If you want to save the list to work on it later, you can click download and download the citations to your computer. So we're pretty excited about this. This project was presented at Nutrition 2025, and the manuscript is currently under review, so stay tuned for that one. Next, I'm going to talk about a project that was self-funded by the Evidence Center, but done to support the World Health Organization's guideline development on the management of obesity in children and adolescents. We conducted 2 systematic reviews on longitudinal data related to endocrine disrupting chemical exposures in children and adolescents with obesity and obesity-related outcomes. Dr. Rupal Trivedi just presented this at Obesity Week, and we're about to submit the manuscript. I'm not going to discuss the details of the results, but I do want to point out a process that we employ to add additional value: a data discovery scan. A data discovery scan is a method we developed to identify data that could potentially address our research question. We did this because during screening, our analysts noticed that many articles were being excluded because the study population did not include at least 50% of children or adolescents with obesity, which was a required inclusion criteria. So again, we wanted to see if we could add some value here. So our analysts rescreened these articles that were excluded for population and identified several studies that met all the other inclusion criteria. As long as the study didn't exclude children with obesity, there's a good chance some of the children studied had obesity. Therefore, it might be possible for the original researchers to do subgroup analysis with their existing data. Or we could pull and synthesize individual participant data from across the studies. These data sources are highlighted in our paper, and our hope is that researchers will conduct and publish these analyses, and this review can be updated with a stronger evidence base. The last project I'm going to speak to today is another project that the Evidence Center is funding in order to support the WHO's guideline development on the management of obesity in children and adolescents. This project is a diagnostic test accuracy systematic review, comparing the accuracy of different methods for diagnosing excess adiposity in children and adolescents. When we took on the project, we planned to coordinate training for our research staff. We were thrilled that Yumisi Tekwangi and Jacques Dins agreed to conduct the training. Yumisi and Jacques are world-renowned experts. They're co-authors and editors of the Cochrane Handbook for Systematic Reviews of Diagnostic Test Accuracy, and they came all the way from the University of Birmingham in the UK to Fort Worth in the middle of August. So given the investment we were making, we realized this would be a great opportunity for researchers from other evidence synthesis groups to come to, so we opened registration. The training was awesome. The trainers did an excellent job and we had so much fun. I am biased, but you can see the quotes from some of the participants here. The trainers were exceptional. I really enjoyed the interactive format. We all got to know each other and made good connections by the end of the workshop. It really was a huge success. And we want to do more of these trainings that support best practice methods and foster relationships within the evidence synthesis community. If you have ideas for future trainings, please email us. We'll be compiling these ideas and hope to do at least one external training a year. Building off our recent training event, and as Dr. Casavale described, we see scientific growth as a collaborative journey that requires engagement, true collaboration, and clear, targeted scientific communications. We also consider these aspects as part of our work. We hope to become a central communication hub for evidence synthesis. We will continue to collaborate with scientists across disciplines to strengthen the quality of our projects and to advance evidence synthesis methods. We plan to extend training and practice events, and we will provide communication platforms and products. Stay tuned for the Evidence Exchange, a platform for knowledge sharing likely to include news and announcements, research briefs, and dialogue through podcasts. Be sure to sign up for our listserv. Thank you. I really appreciate you sticking with us today. And now I'm going to turn it back over to Stella Spiropoulos, who will tell you how to find us in GSA and how to connect with us.
We're proud to be on the GSA schedule. That means we've already been vetted and you can count on fair pricing and a smooth, compliant contracting process. To learn more or find us, just scan the QR code on the slide or search for Texas A&M AgriLife Research in the GSA e-library. Thank you for joining us today. We hope you found our webinar informative and engaging. Before we close, here's how you can connect with us. Visit our website, follow us on LinkedIn, or reach out directly with any questions or feedback. We'd love to continue the conversation. Thank you.